After the 8-week circuit breaker and 11 days into phase 1, could we start phase 2 in a matter of weeks? National Development Minister Lawrence Wong told Bloomberg TV today that Singapore is on track for phase 2 of reopening by the end of June.
Let's get Associate Professor Alex Cook to weigh in. Now, he's the Vice Dean of Research at the Swee Hock School of Public Health at the National University of Singapore. Prof, do you agree with Minister Wong that Singapore is on track to start phase 2 at the end of this month, which would see the reopening of virtually the entire economy?
I think that we're in a very good position to start reopening. We've had over the last few months the intense circuit breaker, and that brought down cases to very low levels. The worry was, of course, that when we relaxed those measures that we might see a pop-up in the number of cases. But so far, actually, the situation has looked quite promising during phase 1. So I think that now is the right time to think about reopening and moving back into phase 2.
Well, Prof. Cook, experts, yourself included, have said that 10 to 14 days post-circuit breaker is a good time to take stock of the situation in Singapore. So how ready do you think Singapore is for phase 2? And what indicators are you using to judge this readiness?
So yeah, I think we're pretty ready. We're in a good position at present. What we would be looking at to try to decide just how ready we are is several different indicators, not just one. So one of them obviously will be the number of cases that we're seeing each day. But I think it's important to remember that there's always fluctuations in the cases from day to day, just from randomness. And so it's important not to look at the number on a given day, but the number over some period of time, and decide whether that's an acceptable level or not. Can we manage that level of infection? But it's not just the number of infections that we should be looking at. I think we also need to look a little bit deeper into some of the features of those infections themselves. So for example, how are we picking up these infections? Are they asymptomatic infections that we're picking up through screening? Or are they symptomatic infections? Maybe some infections that are turning up the hospital with pneumonia. So they all have a bit of a different bearing on how bad the situation is. Another thing that we'll be looking at is how many of these cases are linked up to existing clusters versus how many are popping up seemingly out of nowhere. The more cases which are linked to a cluster, the better. It's worrying if a large fraction of our cases we cannot link back even after several days of contact tracing efforts.
Well, today 18 community cases have been reported. So what do you make of that? Do you think that will derail our plans to move into phase 2, or is it still too soon to say?
Well, it's early days. You shouldn't look at the number of cases on just a given day because, of course, like I say, it can fluctuate from next. I think when we look at the details of those cases, we see some of them are linked up to existing clusters. Some were already in quarantine, and so therefore they pose very little threat to others. And some of the cases that we picked up today were picked up through screening sweeps. And so again, these are relatively lower risk cases. But there's still some uncertainty, and I think investigations are still ongoing about some of the other cases that were picked up today. So I wouldn't read too much into the number of cases today, but we would be looking to see whether it is part of a start of a trend over the next week or so.
Prof, on Monday, the Elections Department drew out contingency plans for the general election to be held safely during the pandemic. Now, many see this as a sign that the election could be held soon, perhaps during phase 2. This plus the need to revitalize our slowing economy. Are we in a nothing can stop us position in going ahead with phase 2?
Yeah, well, hopefully nothing will stop us, but I guess the epidemic is not entirely under our control, and so if the number of cases were to rise sharply, let's say we reopen in July and we start to get maybe 100 cases a day, that would be quite a bad situation. And in that case, we may need to rethink have we opened too much too soon. But I think overall, in balance, the move to reopen the economy is important. Not just for our sanity and mental well-being, but also for the sake of all the people who are in economic hardship because of the circuit breaker measures so far.
The COVID-19 task force has said that under phase 2, more businesses like retail outlets and gyms are expected to resume operations. Households may be able to receive up to 5 visitors a day as well, and dining at hawker centres and restaurants could also be allowed with safe distancing measures in place. Sports and other public facilities will be opened as well. So going from phase 1 to having all of that potentially in phase 2, would you say it's a bit of a leap, or do you think reopening these businesses is still gradual enough?
It's hard to know exactly how much balance to take between the two forms of risk. The risk of reopening too soon, which could potentially allow the epidemic to spread again, versus the risk of not opening soon enough and an economic impact that will create. So I think that it seems to me actually quite a sensible degree that we're allowing the economy to reopen in next month. But I wouldn't be at all surprised if we would continue to take stock of the situation, and then if it turns out that we are reopening too soon, then we'll know about that because we'll see a rise in number of cases, and then we can start to call back just the degree of loosening that we've done.
Well, that was Associate Professor Alex Cook from the Swee Hock School of Public Health. It's always a pleasure to have you on the show, so thank you so much for joining us.